Hi, I'm Bob Schrupp, physical therapist.
And I'm Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
And our opinion, of course, Bob.
Brad, take it away.
Okay, Bob, this is a subject that is important to every parent out there.
Right.
Is you want to keep your children healthy, obviously, and one of the easiest things you can do.
Pain-free.
And pain-free from when they're adults, from their child all the way up until they're adults.
Right.
And this is very critical.
Yes.
Posture.
Yes.
Okay? Posture, and at an early age, we want to teach our kids how to have good posture, which typically the body does naturally. If you watch a 1 or 2 year old, or when they're at that point where they can get up, pick up something from the floor, like a cell phone, just watch them. They'll go just like this.
Yeah.
And they'll pick it up every time naturally.
And we were watching a little friend's baby, and she sits. I was hoping to get some video of her, maybe I still will, but when she sits, she just sits with perfect posture.
Right.
I mean, she's a toddler, so you're born with perfect posture.
Right. So what happens when we buy number one? The 3 reasons, here's the first one. Make sure you get the proper car seat.
Right.
Okay, if you have a car seat that's rounded out and it takes the spine and puts it into this rounded out position.
Or like this.
Right there. Now here, I've got a diagram, Bob. Now Bob was making fun of me on this, but at least it gets the point across. I am certainly not an artist or a professional actor, but...
Lonnie, can you see this, by the way? Let's get her.
Oh, yeah, we don't want reflection. That's good.
Now, first off, this looks like it was drawn by a 4-year-old.
Thank you, Bob. But if this represents the car seat, and if you look at car seats, sometimes they're rounded out, and then the spine will round out in the backwards direction, which puts some pressure on the spine, which at that age they can take it, but the muscles in the abdomen will shorten up, which promotes forward posture, and it actually is teaching your kid poor posture, subconsciously or mechanically without knowing about it.
Yeah, when you're in this position all the time, Brad, as you know, when you stand up, this is going to seem normal to you now,
right?
Because you're in that rounded out position all the time.
You better believe it.
Your body sense teaches you what is right and what's wrong.
So your strollers, your car seats, make sure that they have in the back where their back is, it's straight and not a big dished out area.
Right.
Which leads into something more, which everyone has if you have kids, is cell phones
as they get older.
Yeah, or electronic devices, and it's younger and younger
iPads
all the time now. Watch your children, watch anybody, an adult, and they're going like this.
Yeah.
Typically
they're rounded out and like this.
You continue to force that spine into that rounded out posture, putting pressure on the discs, the ligaments, stretching the muscles in the back, shortening them into the front. And when we get older, we end up like this.
And I'm seeing a lot of kids with this, Brad.
Oh, yeah.
I am, and I mean, I observe a lot of them that are like this already at age 14, 15.
Exactly.
And you're in for a world of hurt.
Right.
And it's gonna start translating into pain.
You better believe it. And the next thing is, now when do you start having your kids take backpacks, or when do the schools want your kids to use backpacks? Right here. And of course you gotta have the biggest backpack or whatever, but the backpack puts weight on your back, especially if it's on one side. It can bring you over this way if you use it on the same shoulder all the time, which a lot of people do. And you compensate by leaning forward. So that also puts you into this forward posture, and it can train your body to be this way and this way over a period of years. So the rule of thumb is no more than 10% of the body weight. So if you weigh 100 pounds, you shouldn't have more than 10 pounds.
Oh my God.
You know.
I know, as I said, my son, I'm not kidding, I think it weighed 70 pounds. I mean, I couldn't believe it.
Right.
One day I was just going to move it. I was like, oh my gosh, I can hardly lift it.
Yeah,
I mean, it was 50.
Right.
It was 50 pounds. I'm not kidding.
Well, he's not a 100 pounder.
No, he's not a 100 pounder,
Right.
but that still wouldn't make 10% either.
So lighter backpack, use both straps, put it across both.
Right. Oh, that's going to fit you. Wow.
There we go. So that pulls you back into better posture, spreads out the weight even, pressure off the spine. All right, and I think, these are 3 important things. Proper seated posture as an infant, electronic devices, good posture with that, as well as the backpacks. And as a parent, I'm convinced that you need to teach your children at the supper table to sit up tall at an early age. And the neat thing about this, because I did this with my daughter, I would have her at 3 years old, you need to sit up, good posture at the table. Within a year, she was doing the same thing back to me.
Yeah.
Dad, you need to sit up.
And it's funny, Brad and I haven't even talked about these experiences, but exact same for me. I did it to my 3 kids, and you know, you think you're a nag, and you are, but by later in the later years, they're reminding you, and they remember, and now most of them are, they're all adults now,
Right.
and every one of them is well aware of posture,
right.
So it becomes just a normal thing.
Yeah, so if you want to
like brush your teeth,
yeah,
keep your posture. You know what I mean?
eat good food,
Yeah,
good posture.
Good posture.
And
So-
you know, like my daughter in the orchestra, I can see this. You know, there's 50 kids up there, and she sits up in the violin
Yeah.
with really good posture, and other ones are like this, and it's like.
And what does she look like? She looks more like a confident young adult, doesn't she? She
Absolutely.
doesn't, where this looks like someone, you know, a slumpy, slouchy,
Right,
you know,
right.
I mean.
That carries over to
Yes,
all
it does.
aspects.
It carries over how you present yourself.
There's one area it doesn't carry over, and I don't think it does.
What's that?
I don't think no matter how your body posture is, it's not gonna help that broken heart that we've been working on.
You know, we've been working on it also.
I
think
know.
by now we get it.
I think we can relate it somehow, we'll work
Yeah,
on that,
all
so
right.
take
Thanks a
care.
lot.